My name is Emma Williams, and I am currently pursuing my master's in family nurse practitioner degree. For my Nursing 600 project, I will be discussing the nursing theorist Patricia Liehr and her work in the creation of the story theory. By the end of this presentation, my goal is for the listener to be able to identify nursing theorist Patricia Liehr and her development of the story theory, describe the middle range aspects of the theory, understand theory assumptions and components, describe the theory's contributions to nursing research, adequately critique the theory in question, describe the theory's connection to nursing practice, and understand the story theory's contributions to healthcare. Dr. Patricia Liehr is a nursing theorist and currently a professor emeritus at the Christine E. Lynn College of Nursing at Florida Atlantic University. She is a co-creator of the story theory along with fellow nursing theorist Mary Smith. Liehr wrote her dissertation in 1992 on studying blood pressure effects while talking about the usual day. Smith and Liehr connected during a medical conference and bonded over their passion for holistic medical practice and how it applies to Western medicine. Additionally, the two authored a textbook, Middle Range Theory for Nursing, in 2018. On a personal note, I am passionate about providing holistic aspects of medical care to patients. Liehr's story theory teaches different avenues to help patients achieve their health goals and has had significant success in nursing education and research. The understanding of intentional dialogue and creating a space for the patient to tell their story allows growth and success for both the nurse and the client. The story theory is a middle-range theory described as a narrative happening of connecting with self in relation through intentional dialogue to create ease. We will discuss more about what this sentence means in the following slides. The theory was developed in 1999 and further refined in 2006. The theory encourages patients to assess their current life situation from a narrative viewpoint to understand their past and present as it relates to their healthcare journey. She describes the human story as a health story in the broadest sense because every aspect of our lives is modified by how we feel and react. I have created a concept infographic on the word story. A story can have different meanings to an individual, and it is important to remember that a story is a subjective term. It can be used in the form of fiction or nonfiction, and all aspects of a story can paint a picture of the current situation being experienced. Stories can be told to create joy or to describe worry or fear. As a nurse, we have to understand that everyone has a life story that is full of meaning and underlying themes, and we have a responsibility to guide a patient by providing reflective feedback and guidance through their particular story path. I have provided a model case regarding a patient named Mr. C. Mr. C presented to the hospital for acute kidney injury following outpatient chemotherapy for prostate cancer. He has a good prognosis and has been tolerating chemo well until this point. He is withdrawn with nursing staff but agreeable and adherent to medical treatment through gentle hydration and monitoring of labs. Mr. C is on chemotherapy precautions and visitors are limited due to current COVID precautions. His nurse notices his flat affect and spends additional time at his bedside asking questions about his personal life. Mr. C eventually admits he has concerns about being able to provide for his wife and spend time with his grandchildren. He states that he feels guilty for not being present in the past due to a demanding career. The nurse reminds him of his positive cancer prognosis and the potential to spend meaningful time with his family during his retirement. The nurse calls his wife and requests that she comes to spend time with him while inpatient. Mr. C expresses gratitude for the listening ear and admits that he can tend to fall into depressive episodes. The nurse educates Mr. C and his wife on counseling opportunities and reinforces that his current treatment will be helpful to his outcome. The nurse has created ease in the patient by providing therapeutic communication and facilitating a space for Mr. C to convey his story. The story theory is essential in everyday nursing practice to guide a patient towards positive health outcomes. The story theory operates under the assumption that a patient is able to accomplish the following: alter the perspective of their current situation or world viewpoint, expand the present to gain awareness of the past and future, clarify life's meaning as it relates to human potential. Liehr stresses the fact that the nurse has a great responsibility to facilitate this aspect of intentional dialogue to create a space for a patient to tell their story. This theory is derived from three components that make up the mantra of the theory. This includes intentional dialogue, connecting with self in relation, and creating ease. We will discuss these components in depth in the following slides, as well as what responsibility the nurse has to assist a patient through these three components. Intentional dialogue is the first component of the story theory. Patricia Liehr states the process is typically started by purposeful engagement with a health struggle that affects daily life. It consists of engagement with the patient to determine their life experiences and personal goals. While the patient's story is entirely their own, it can only be told in a safe and trusting relationship where the nurse can guide the patient through the story, facilitating conversation that ascertains future directions and current situation. Intentional dialogue energizes the experience of being alive by bringing validity to a patient's story and allowing them to feel heard. Intentional dialogue consists of two dimensions: true presence and querying emergence. True presence is what the nurse provides to the patient. This focuses the energy back on the patient while keeping up with the rhythm of the story. Querying emergence is the clarification of vague story directions. If a nurse remains in true presence, they are able to query the development of the health story and provide feedback where indicated. Connecting with self in relation is the second component of Patricia Liehr's story theory. This is composed of personal history and reflective awareness during the unfolding of a story. When a patient is able to engage in reflective awareness, they become more in tune with their bodily experience, personal thoughts, and feelings. With the nurse's assistance, the patient can connect with themselves by understanding their past, present, and future. This experience allows the patient to identify their personal fears of the unknown and clearly see the present situations by engaging with events of the past and projections of the future. The connection with the self is essential in the end goal of creating patient ease. Creating ease is the third component of this theory and occurs as different perspectives come together to create an understanding. Ease is what is accomplished when a nurse adequately pursues intentional dialogue with the patient. This is based on the assumption that a patient is innately in search of ease and the nurse can enable the patient to experience it. Creating ease is comprised of remembering disjointed story moments and flow in the midst of anchoring. Remembering disjointed story moments means connecting different events through time in the process of telling a story and identifying different themes as components of the health story converge. Flow in the midst of anchoring describes the ability to move through different aspects of the story while remaining anchored to the present and understanding how the two relate. Liehr recommends using her story inquiry method when utilizing the theory to perform research. This is a systematic approach used to guide data collection and analysis. She recommends 5 processes of inquiry, which are as follows: gather stories about a complicating health challenge, decipher the dimensions of the health challenge, describe the developing story plot, identify movement towards resolving, and synthesize findings to address the research question. At this time, there have been 5 research studies that reported findings guided by this method. The story theory has been utilized in a few different ways in nursing research. Patricia Liehr performed a study among 24 patients with stage 1 hypertension. In addition to the diet and exercise regimen, she studied the impact on blood pressure with the addition of story-centered therapy. The study found that patients who experienced story-centered care had lower blood pressure than patients who were just provided with the diet and exercise regimen. Also, a study utilizing the story theory was performed on the effect of reflective garden walking on adults with increased levels of psychological stress. In this study by Ruth McCaffrey and Patricia Liehr, outcomes were measured in levels of hopefulness, personal growth, and quality of life. The study proposes that psychological stress can present in somatic ways, including fatigue, headache, and decreased immunity. Previous research studies have proven the benefits of exposure to a green environment and the positive effects on mood, memory, and stress levels. This particular study was performed over a period of 2 years, and the study goes into the specifics of how the participants were selected. After engaging in reflective garden walking in groups or individually, with a focus on self-reflection, the measurement tools utilized showed decreased levels of psychological stress and improved quality of life. This study adds credence to the story theory's focus on self-reflection to create ease. I believe all theories are able to be critiqued, and a critique can better assist in the refinement of the theory. The story theory, while important to utilize in clinical practice, can potentially be difficult to follow because the components are not linear but rather occur at once. Because of this, if a nurse does not possess the natural ability to connect with the patient and engage in intentional dialogue, I wonder if the components of this theory may be perceived as vague in nature. Due to the middle-range nature of this theory, it can be utilized in both general and advanced practice. The benefit of constructing a middle-range theory is to minimize levels of abstraction while still applying to a broad scope. This theory can very easily be used in all aspects of healthcare. However, because the process of developing a story may involve multiple conversations, The user can be limited to the bedside or a clinic where the nurse regularly sees the same patients. Regarding development, I believe the story would do well to have specific research studies measuring the validity. The theory has been used as an adjunct in other research studies, but not on its own. The knowledge of this theory is enough for a nurse to utilize in practice, which will assist in further refinement. The story theory is applicable to all aspects of nursing practice. As nurses, we have an inherent desire to understand what matters most to a patient during their health challenges to assist in guiding them through the process. A way that nurses are able to gather a patient's health story is by initiating a conversation about their family history, the patient's methods of self-monitoring, as well as identifying their story path. The story path occurs when a nurse understands that the story involves the current health challenge, past events that led to the challenge, and future projections. Let's give an example of how to gather the health story to better serve a patient dealing with a health challenge. A 40-year-old male comes to the outpatient primary care clinic to establish care. He is considered obese for his height-to-weight ratio, and a previous provider started him on metformin 500 mg BID for the treatment of newly diagnosed type 2 diabetes. He does not want to be on medication and would like to better control his diet, but is a truck driver who works long hours, and fast food is the most convenient and least expensive option. As a practitioner, you understand the importance of gathering the health story to provide individualized care. With prompting, the patient is able to recognize his health challenge as fear of diabetic complications due to his lifestyle choices. You create a family tree by asking questions about his home support and recognize that he has a supportive wife and 2 children whom he wants to set a good example for. You determine that he has not been taking metformin due to gastrointestinal side effects and has not been checking his blood sugar. Through discussion, it is clear that the patient has never considered himself unhealthy or overweight until recently, and this is taking a toll on his mental health. He is motivated by a desire to be there for his children and wife and reached a turning point in his health challenge on the diagnosis. Through this intentional dialogue, you were able to provide the patient with a dietary plan, discuss ways to bring healthy meals with him on the road by enlisting his wife's support, ensure he has the right tools to check his blood sugar, and discuss ways to be more active by planning outings with his kids. By guiding the patient through his story path and utilizing the listed bullet points, you are able to create ease within the health challenge. In addition to the theory-practice connection applicable in general and advanced practice, the story theory has provided healthcare with a way to inquire about the patient's story and utilize the information gathered in these conversations to turn them into scientific narratives for further development. The story plot and inquiry process consists of 7 steps. The first is gathering the story of the complicated health challenge, usually through multiple discussions in a place of trust. The second step is composing the reconstructed story, which occurs in the frame of reference of the nurse by merging different aspects of the story. The third step is connecting existing literature to the health challenge. This assists with the knowledge development of the nurse and allows the nurse to provide personalized patient education regarding their health challenge. The fourth step is naming the complicating health challenge in layman's terms that the patient can easily understand and identify with. The fifth step is describing the developing story plot. This requires examining the story features, important events, and turning points that affected the health challenge. The sixth step is identifying movement towards resolving by providing resolution-oriented behaviors that assist the patient in better managing their health challenges. The seventh and final step is collecting additional stories about the complicating health challenge. This step implies that the work of the developing story is never complete, but an ongoing process. In conclusion, embracing story is essential in nursing practice. Engaging in true presence with the patient is crucial in guiding a patient through their story. When engaging in true presence, the questions asked are not as important as the context in which they are asked. The questions need to be proposed in relation to the story without directly pointing out obvious health challenges, but rather engaging the patient in open discussion to gain knowledge of self. When initiating intentional dialogue, the nurse must offer opportunities for the patient to embrace their story as their own. This will increase nursing knowledge and assist the patient through their health challenge. The embracing of the story is beneficial to both the nurse and the patient. The nurse gains a better understanding of how to individually treat the patient through open dialogue, and the patient is left with a further understanding of themselves and how their story relates to their health challenge. Stories are a natural link between practice and research and should be further utilized in nursing education to become a part of every interaction with the patient. This concludes my presentation on Patricia Liehr and the story theory. Thank you for the opportunity to talk about this subject in the Nursing 600 course.